Hey, good afternoon, everyone, and thank you for joining us for our October Forum on VA Human Research. Before we get started, I'm going to go over just a few gentle reminders during the forum. So we ask that you mute your mics to avoid echoing or background noises, and also to avoid activating your camera to preserve bandwidth. In lieu of voicing your questions, we're going to ask that you use the chat function. We'll have Dr. Summers and Alyssa will be monitoring the chats, and they'll respond to your questions, and then we'll open it up for question and answer towards the end. And then also, so everybody is aware, the session's being recorded, and we will provide the full presentation and slides on the VPR website, usually within a few days after the presentation ends. Okay, so during today's presentation, we're going to start with a program overview and staff changes for the VA by Dr. Kamat. And then I'm going to cover some process improvements that we've been working on over the past few months for VA Human Research submissions and IRB-Net, as well as a couple of items that we plan to implement in the near future. Then we plan on breaking for questions on VA Human Research. And after that, we're going to close the forum with some staff updates from some of the other VPR offices, Research Administration and Quality, IRB, and the Clinical Trials Office. And now I'm going to turn it over to Dr. Kamat for an overview of the VA Human Research Program. When you're ready, Dr. Kamat.
Thank you, Brandy. Can you hear me?
We can hear you.
I can hear you.
Okay, thank you. So, I'm Amrita Kamat. I'm going to keep my video off for bandwidth purposes. And so I'm the Chief of Research here at South Texas Veterans Healthcare System at Audie Murphy VA Hospital. So welcome to the Forum on VA Human Research and Process Improvements that has been so nicely
Dr. Kamat, are you unmuted?
No?
I can hear you just fine.
Yes, so can I.
We can hear you okay.
Is there anyone others? Brandy, can you hear me?
I'm trying to bring up the chat to see if
yeah, we heard Brandy too.
But she's not responding. Is there anyone else who's in the OCR office who's on who would be able to connect with Brandy?
Amrita, go ahead. Can you see the next slide now? Sorry about that, guys.
Okay, so we can go back to the first slide. I'll come back to this slide later, Brandy. Okay, thank you so much. I'll start again. I'm Amrita Kamat, the Chief of Research at South Texas Veterans Healthcare System. And so welcome to the Forum on VA Human Research and Process Improvements. And this has been put together so kindly by the Office of Clinical Research at UT Health San Antonio. And I'd like to thank Brandy Orton and her team for doing so. So as many of you are aware, the UT's IRB has been the VA's IRB of record for many years now. However, for a study to be approved at the VA, there are many institutional pieces, including different approvals, processes, and ultimately, of course, approval by the VA's R&D committee that are required. Now, some of these functions were conducted by, as many of you may be aware, by VA's human subject coordinators. These functions are now going to be conducted by the Office of Clinical Research at UT Health. And as the IRB and some of these functions are now both being conducted by UT Health San Antonio, they've been able to really look at our processes and have helped improve some of these. And I believe this will be very helpful for our investigators. And this will be explained in greater detail by Brandy Arden later in this program. I would also like to add that a number of functions like your safety approvals, research privileges to conduct studies at the VA, your material transfer agreements, data usage agreements, and of course the R&D approval, all still will be completed by the research staff at the VA. And of course, most importantly, the ultimate responsibility of the overall human research program at the VA will lie here at the VA within our research service office. So with that, I'd like to introduce you to the staff at the VA research office that are engaged in human research program and some new additions to our family. So we have Dr. Polly Noel, who is the Assistant ACOS for Research, Human Studies. And at this time, I'd really like to take this opportunity to thank Dr. Noel, because for the past 3 years, she has worked tirelessly to lead this program and make sure it's compliant, especially from last December when she did all this single-handedly till we got help from UTESCO's OCR office in May of this year. And now more recently, we have more additions to our VA research family. Dennis Bryan, many of you know him. He's the administrative officer for our research service and helps me manage the whole service. We have Dr. Alicia Swan, who is a new addition to the research group. She is actually the director of the polytrauma research group, and she's going to be, or she is helping us with our data usage agreements and material transfer agreements. And Cassandra McFadden also joined us recently. She's our health science specialist, and she will help both Dr. Noel and Dr. Alicia Swan with the DOAs, MTAs, and also any other interactions that we may need with central office and such. And with both with Cassandra's help and Alicia, I think that will help Dr. Noel greatly, because although she'll continue to help us, she can now hopefully devote a little bit more time to her own research projects. You have Ken Price. He is our safety IBC and IACUC administrator. So all the human subject studies that require safety approvals or IBC approvals will be handled by Ken. Thomas Sierra is in charge of our research privileges as well as training. So also Eliane Diaz, she will help. She and Thomas will be in charge of these functions in our office. Michael Motter is our statistician, not only helps with all the statistics that are involved in the human studies, but any of the preparatory to research work that you may need. And Brandy will talk a little bit about this in her slides. And lastly, most importantly, we have Paul Hartman, who is our research tech support, but he also helps us with, giving folders, VA research folders for our PIs, and currently is helping us with conducting the R&D committee, managing the R&D committee. So with that, I will turn the mic over to Dr. Polly Noel so she can talk a little bit more about the human research program.
Thank you, Dr. Kamat. Can everyone hear me?
Yes.
Okay, great. I just wanted to go over a few additional points that Dr. Kamat touched on. And first, I just wanted to emphasize that all VA facilities that are engaged in research must ensure both that human subjects protections are in place as overseen by Institutional Review Board, and that the institutional requirements that are mandated by the VA's National Office of Research and Development have also been monitored or are monitored and verified by the R&D service. So a little bit more about that. Some newer investigators and project coordinators sometimes refer to our R&D service or the R&D committee as an IRB. So although many larger VA facilities have their own internal IRB, the South Texas Veterans System does not. We rely upon several external IRBs for human subjects protection oversight through memorandums of understanding as allowed by the VA's Office of Research Oversight. And several IRBs that we rely upon include, of course, the UTESCA IRB, the VA Central IRB, the NCI IRB, and our two commercial IRBs that we are relying upon for some of our studies, Advara and the WCG. But the R&D committee, as assisted by the R&D administration, is responsible for making sure that all human focused research has received the required IRB approval or determinations. And in effect, the IRBs are considered subcommittees of the R&D committee. So in addition to the human subjects protection oversight, there are additional, the institutional requirements, again, that must be monitored and verified by the R&D Service Administration as overseen by the R&D Committee. And the top ones, the most important ones, but they're not all of the things that are considered, but the most frequent ones that come into play are issues related to personnel, credentials and training, privacy, information security, safety, and clinical resources. And in some instances, the institution requirements are more stringent than those required by, for example, the IRB of record. And a good example of this is information security. National VA has very strict standards regarding not just what information is used, but how it is stored and how it can be transferred, etc. To assist in the processing and documentation of all of the required approvals, if you could go on to the next slide, please. Last year, the National VA's Office of Research and Development mandated the implementation of the VA's Innovation Research Review System, or VAERS, to better standardize the VA's review and approval process nationwide. And VAERS, the VAERS program includes a VA-approved version of IRBNet, which is a web-based research management review system, included new submission pathways for how new studies, amendments, continuing reviews, et cetera, were processed, as well as new standardized forms and templates. Now, the IRBNet has been a learning curve for everyone and required several changes, including one you'll hear about today during Brandy's presentation. But the IRBNet's name has been, I think, in some cases, confusing in and of itself to some investigators. And although the commercial version was originally created to be used by IRBs, the VA-approved version is being used to support VA facilities' institutional reviews, as also capture and serve as a repository for documented IRB approvals for VA studies. And if you could go on to the next slide, please. And it's particularly confusing or that some IRBs that we rely upon also use the IRB net, while others do not, such as the Utusca IRB. So currently, of the 5 main IRBs that we rely upon, only the VAC IRB and the Western IRB, and actually that's been changed, the WC IRB, they use IRB net. And so for those studies that are overseen by VAC IRB and the WCG IRB, the submission processes will differ slightly. But regardless of the IRB record, we do just want to emphasize that the Utusca OCR staff, overseen by Brandy Otten, are now helping to process the institutional approvals for all VA studies and will assist study teams in this process regardless of the study's IRB of record. And now we're ready to hear about the from Brandy Otten about some of the processes and changes that she and her team have worked to implement.
Okay, great. Thank you, Dr. Noel. So why have the Office of Clinical Research assumed this responsibility? The OCR has been providing an institutional review for human protocols on the UT side since 2014. And so when the idea was proposed by Dr. Kamat, it seemed like a really good idea, and it made sense for us to help. So on May 15, 2022, we started assigning new IRB net submissions to OCR analysts within the IRB net system. So the OCR is managed by me. I have a great and amazing team. If my name sounds familiar to you from the VA side, it's because prior to the 9 years of experience I've had over here within OCR, I had 11 years of experience on the VA side, and 6 of those was within the research office directly. And then I have Patricia Alexander on my team, who's a senior coordinator. She's been with us forever. She has quite a few numbers of years of experience on the IRB side, and has been with OCR for at least a good 5 years. So she's able to help in many areas. Alyssa Hernandez is a research compliance coordinator. She is been with us for about a year. I have Bhumi Patel as a research compliance specialist, been with us a couple of months. And finally, Stephen Blake Lewis, commonly will go by Blake. He has been with us as a research compliance specialist for almost 2 months now, and we're looking to hire one more. You can reach out to any of them. They're all cross-trained to manage UT and VA reviews. So as Dr. Noel indicated earlier, there's required processes and forms that we just are unable to work around. And one of these is the VA preliminary review. So the Privacy and Compliance Assurance Program directive requires that a preliminary review from the privacy officer is completed prior to IRB approval. So what does that mean for us? It means that the IRB net submission, the VA IRB net submission, is required prior to an IRB submission. Now the IRB net submission process is very lengthy. And so I kind of laid it out here, and we find that a lot of people need help with it. Basically what you have to do is you have to submit to IRB net. We look at that and we get it over to the privacy officer to do a preliminary review. Once the preliminary review is complete, then we let the study team know that they have to submit to the IRB. They receive IRB approval. We have to unlock the IRB net submission package so they can submit the IRB approval letter or documents in IRB net. Then we have to send it off for a final privacy officer review. So it's ready to go to R&D committee for review and approval. And then you finally get your approval letter from ACOS for R&D. Now, why did I tell you that? We know it's an a very tedious process, right, with a lot of steps. And so we want to let you know how OCR can help with that. What we've done over the past few months is we've created a VA dedicated website. We are ensuring that the same OCR analyst that's assigned an IRB net is also tracking UT IRB studies. Dr. Noel already kind of went over to you that we will help with external IRB submissions on the VA side, which are completely separate from UT. But when you're using your UT IRB, we're assigned those studies, whether they're UT or VA, and we're going to track them on both sides for you. If it's a VA only study, we're still going to assign a business item and we're going to track those for you. So we know exactly when it's IRB approved and can help you get it into the system. And then we have OCR analysts helping with the initial review of the IRB application. They are very well versed in the UT IRB paperwork. And so they're able to review that for you and actually help you get it submitted onto the IRB side on the UT side. And then they have experience on the UT side already with submitting to Advara and WERB. And we've already handled some submissions to VA Central IRB. So they're going to be able to help you with those as well. We also have an on-demand concierge service. So we used to have scheduled times within the system. Now you can actually go on and ask for a concierge service with OCR/VA or any of the offices and give us your availability, and we'll schedule either a Microsoft Teams meeting or we can still do in-person meetings at your request. And then finally, we created a VA Human Research at utusca.edu. It's consistently monitored by someone from my team. They respond to things and emails that come back and forth, normally within an hour. So you can always reach us at that address. Okay, this is a screen capture of our VPR website. And I wanted to point out a few things. So the address is at the top of the page. And then we have VA Human Research website. We have posted it on the main page with a link towards the bottom. And then under quick links, which is circled towards the top, it brings up a menu on the right. And so we have VA Human Research right at the top. And on that VA Human Research website page, we have information on new study submission process, as well as submission processes for continuing reviews and institutional updates, amendments and modifications, personnel changes, and inactivations, as well as IRB net registration and training information, help documents in different areas. And at the very bottom of the page, we also have VA contact information, which includes some of the introductions that Dr. Kamat did in the beginning for Thomas, Ellie, and Ken. And I'm not going to go over the website and the VA Human Research page on purpose, because I want everyone to go check it out after the presentation. Now on this page, there's a few more things I want to point out. We have a link to the offices, which shows each of the different offices, what we do, and information on that, the top of the page. In the quick links section and at the bottom of the main page, if you were to scroll down farther, we have the link to request a concierge service. And then we have contacts us. If you don't go to the offices, you can also go to contacts us on the quick links. And we've changed that to say OCR and VA. And you can see pictures of my entire team. You can get their phone numbers, each individual phone numbers and email addresses, any information that you need in order to be able to contact us. So now I want to go over some changes that we've made. We've spent a lot of time over the last few months going through all the forms, getting used to them. With the experience that I've had at the VA, I had the basics down, but there's been so many changes. So one of the first things that we did is we looked at the human study checklist, and we had the checklist, and then we had the README document. And so we knew what forms needed to come in, but then we would look at the README document and we'd have to figure out where to go to it. So we worked really closely with the research office, and we came up with 3 different checklists that we could use that would have the information on them that used to be on the README document as well. So it's going to ask you to answer yes or no. or yes or NA on each of the documents. So it tells you basically which documents are required and which ones are optional. It tells you if you have to submit within IRB-net first or not at the top. It'll tell you that your FCOI forms need to come in by email. And it gives you all that information on one document. The other thing that we did with this document is we included the statement of commitment and understanding by the PI at the end. We were asking investigators to sign both the checklist and the statement of commitment and understanding PI. So this allows for them to just sign one document and then share it with their service chief and get it signed as well. We did create 3 different checklists, a different checklist for non-human and then unfunded, just because the submission process is a little different. So for non-human research, you can get your determination first without going into IRB-net, and unfunded are specific types of research. So I would, you can find these on the website, or you can find them in the IRB-net under forms and templates. I would check them out, let us know if you have any questions. They're also PDF fillable and they're ready for electronic signature. Okay. The next change that we worked on was the privacy checklist. So previously in IRB-net, they had 3 cheat sheets that were listed in there, and they were for the different types of studies. You had a cheat sheet for a chart review or a human study that had a consent form, and so there was different types. But those cheat sheets were actually causing problems when we would send them over to the privacy officer for review. They were supposed to be used for information and not to actually be completed. So we were finding that that was actually causing a big delay. We also had like a page of written instructions. So what we decided to do is we removed the cheat sheets and we posted in forms and templates a new instruction sheet. And it will ask you to fill out the initial page. And then for each of the following page, instead of referring to that cheat sheet, our instructions give you an example for which documents to fill in the comment sections. And that'll satisfy the requirements for review by the privacy officer. We also added the privacy checklist, the BA 10-250, to the main forms library, so that you didn't have to go to a different library within IRB-net and download it. Okay, and one of our bigger changes that we did, which took us a while to do, and I'm gonna thank everybody that helped us through the process, because we did make changes, multiple changes to the personnel review throughout the last couple months, and people were very, very patient with us. Basically what we did here is we went and looked at the continuing review application, the institutional update form, and the R&D amendment form, the UT personnel form, and the VA project cover sheet. And each of those forms had personnel listed on, which means that we were collecting it in multiple places. Now with the UT personnel form and the VA project cover sheet in these forms, we were also collecting it on the VA side and the UT side, which was creating administrative review burden on both the OCR analyst, Ellie in the VA research office. She was reviewing on the OCR side and IRB-net. So we made a few changes, and what we decided to do at the end was just to keep personnel listed on the project cover sheet because it's required by the VA. And we removed VA personnel on the NSTEM. And then we also removed it on the continuing review and the institutional update form and the amendment form. It didn't go away completely. It doesn't ask you to list them on there, but it does ask that you either verify that your project cover sheet has the current personnel listed, or that you submit one with the continuing review institutional update form or the amendment form at the time that you're making that change. If you have a personnel change on the VA side, you would submit a revised VA project cover sheet. Now, some of the other changes we made to the forms listed on the top, we took off the requirement for signatures on there. And so those forms are no longer required to be signed by the PI. And so I want to mention that just to make sure that everybody's going to the forms and templates library within IRBnet and making sure they're using new forms. And then I wanted to go over a couple things that we're hoping are coming very, very soon. This one is actually should come sooner than later. Michael Mader, who was introduced as a research statistician by Dr. Kamat, he has put together some information on accessing national VA electronic health records through a DART application, and then also, data nationally for preparatory to research and QA projects. And so we're hoping to get that up on the website within the next week or two. So we hope that you'll look out for that. And in the meantime, we've provided his information in case you have any questions. The next thing that we hope is coming soon is a My COI module within the VA IRBnet. This would be for investigators to fill out their conflict of interest forms. So it's to serve as a smart form in lieu of the paper forms that are getting emailed in now. It allows for investigators to sign within the IRBnet system. It would mean that the FCOI acknowledgement form is no longer required. We actually have a training set up. Dr. Kamat, who's the FCOI administrator, the VA research staff and my team with IRBnet on Tuesday. And so we're looking at this very closely. We don't plan on implementing it till we've had the training. We've gotten the training instructions, updated our forms and our checklist, and we've broadly communicated that to everyone on the listservs and the website, have all the instructions available. But we are very interested in it. We know this is a big change for the research community, but it has cost a lot of administrative burden. The study staff collecting those, and also us trying to do the acknowledgement forms and keep them within a system. We feel like Dr. Kamat signs off on at least 50 every month, and they don't come in at the same time. So we're really hoping that this will also alleviate a lot of the administrative burden for her, so she can help out with the bigger issues within research, so we can get a lot more new studies approved. And with that, I'm going to stop for questions on the VA. If anybody has questions, we can go ahead and put those in the chat. And Dr. Kamat, have you been watching those? Are we doing okay on questions? Dr. Summers?
I think we've answered all the ones that have been presented so far, but if there's others, we'll watch for those to come in.
Okay, thank you.
I have a question. So I'm one of the residents, and I had started the IRB process for one of my projects previously. Mine is mostly focused on education and like communications between nurses and residents and other ancillary staff. And so I'm assuming this would be human research, but how do I make sure that my PI and my mentor is registered correctly in the system so that when I'm done submitting that there aren't any holdups?
Okay, and which system are you referring to?
So I guess the VA side, she's a VA faculty, but she's also UT adjunct faculty.
Sure.
And so I just want to make sure that she doesn't have to do any additional training or credentialing to make sure that she's in the system correctly.
Okay, so my team can help out with any IRBnet registration, and you can reach out to us. If you reach out to VA Human Research at UTESCA, we can help you with that. Now, if you're looking to make sure that training and credentialing is done, we're going to put you in contact with Thomas Sierra at the VA, and his contact information is also at the bottom of the page. But if you want to reach out separately after this, we'll go ahead and help you with each of those items.
Okay, perfect. Thank you so much.
You're welcome.
So Brandy, there is a question in the chat about the privacy form, and the question is, where will we put the form that satisfies each requirement? Do we still need to put where that is on that page? For example, like page 40 of the protocol.
It doesn't have to be that specific. Most of the examples that I've listed on the guidance document are referring to taking care of those priorities in the consent form and the institutional form, the HIPAA waiver. Those are usually the documents that cover the privacy checklist requirements.
Brandy, this is Sam Galley. It was my question.
Okay.
So I agree that was usually what satisfied it. But for a long time, the privacy officer wanted, if we said, HIPAA waiver page 3, we would have to say page 3 or protocol page 15 to satisfy that requirement. So I think just saying the form is far better. I just wanted to confirm that we can drop the page from it.
We have not listed the page. We've been working with Nigel, the privacy officer, for the last couple months. This is kind of what we've agreed to. And the last 5 that we sent through, they went through pretty smoothly. So I think you'll be okay.
Thank you.
Right, and if I could just chime in, I think that was that Mr. Burns, it helped him to get oriented to the privacy checklist when it was first initiated a couple of years ago. And I think that as far as I can tell, the last over the past, say, half year, that really has not been an issue. And I think also when the privacy checklist review requests are sent to Mr. Burns, I think it also helps that we've tended to provide him a little bit more background information to avoid him having to perhaps feel the need to search through the different documents, try and find some specific information for himself.
I agree. Thank you, Dr. Noel. Dr. Summers, any more questions right now?
That's it in the chat right now.
Okay. Sorry about that. Okay, on to the next slide. So from here, I would like to introduce Melanie, who's the Director of the Research Administration and Quality Office. She she has assumed some of our OCR and IRB staff, and her program is a little new. So I'll let her describe that and introduce her team. Melanie, when you're ready.
Thank you very much, Brandy. My name is Melanie Zuniga-Rapp, and I know I've worked with a lot of you who have probably logged in my role as director of the COI program for many years. Well, our team has grown. We have now expanded past COI and taken on the education initiatives within the research protection program area. We are looking at quality assurance and quality improvement initiatives as well as just the general administration across all of the research protection program departments to create a centralized process for everyone and work more efficiently. The name of our team is the Research Administration and Quality Group. With me is Danny Gordon. She is a senior compliance coordinator. Thank you. She handles mostly the daily operations of the COI program. She also is assisting with the Clinical Trial Scholars program and the Navigator program that many of you all are probably aware of. Crystal Kilpati is also a member of our team. She is also a senior compliance coordinator, and she heads the education initiatives for our area. Cheryl Blaylock, also compliance coordinator, research compliance coordinator, and she's really our data person and just has her hands in a lot of different areas. We rely on her heavily to ensure that we have the data to support our quality improvement and quality assurance initiatives within the area across the research protection programs. And then, of course, we have Kat Gonzalez. She's our administrative assistant, and she is really charged with the day-to-day operations of our office, not just research admin and quality, but all of the research protection program offices. Thank you, Brandy.
Thank you, Melanie. So now I'm going to open the floor to Jeanette Watterson, who's our Associate IRB Director. She's fairly new to the office, but she's going to go over many new changes to the staff on the IRB.
Hi, everyone. I'm Jeanette, Associate IRB Director. In the picture to my left, you see Wanda Quezada. She's our IRB Director. 4 of the 6 members on our IRB office team have been here 6 months or less. And the 2 members who have been here longer are actually in new positions. So everybody's kind of in a learning phase. The good news is we have a great team. They're all super smart, and they're also very oriented to helping the investigators. So Stephanie Reyes is our regulatory reviewer. She was previously an analyst, and she's taken on a huge new role reviewing our expedited and exempt studies. She also does progress report reviews. Rebecca Rivera is our senior research compliance coordinator. She's I guess, been here the longest of the analysts. Our other 2 analysts are Ceci Hinojosa and Stephanie Perez. Both of those are pretty new. They got here in May and I think July. So anything we can do, don't hesitate to reach out. We're here to help. Thanks, Brandy.
Thanks, Jeanette. Okay, and finally, the clinical trials office, who you see has grown a lot. Patricia, I believe you're going to go over the staff changes on this one when you're ready.
Yes, thank you, Brandy. Our CTO office is under the leadership of Jason Bates. He's our director. I'm the manager of research operations and really oversee the budget analyst part of the division house, if you will. We have Kathy Hagelin. She's been with us many years. She's our budget analyst senior. We also have directing your focus in that middle column. We have Joshua Elder. He's our budget analyst intermediate. He's been with us for over a year and is proven to be a great asset for our team. We also have Claudia Holbrook. She's a budget analyst intermediate. She joined our team a few months ago and still is getting up to speed and is learning very quickly. We're happy to have her. Mitch Andre and Nidia Rivera Hernandez are our newest budget analyst, and we are excited to show them all there is about clinical research. They're new to the institution, and you'll be hopefully interacting with them very soon on your next clinical trial budget. Then we have, going to the left, Celia Aviles. She's our clinical trial specialist. She, along with Claudia, help the clinical research community make sure that their participant payment plan is up to speed and finalized and covered. If you have any questions, they're the ones to ask. Thereafter, we have Maria. She is the application systems analyst. She helps with all of the Velos e-research application and make sure that all of our clinical trial system is up and going, and she's our go-to for any technical questions. We have Linda Schrack. She is our clinical trial specialist. She also helps make sure we are covered on billing risk reviews. She is training with Jay Santiago Delgado as a billing analyst to help review queues, billing queues, if you will. Santiago has been a part of the institution for many years and brings a wealth of knowledge to our department. We're very happy to have him. We also have Amy Richardson. She is a financial analyst senior and is new to our billing and invoicing division and is training with Jason to make sure that we are prepared to add more centralized service for the research teams and make sure that we're able to capitalize on all the details that we capture in our clinical trial budgets. We are very happy to be fully staffed. Once we fill the vacant position at the lower bottom of the slide, we are looking for a manager of clinical research finance. So please, if you have anyone that you would like to recommend, please send them our way. We do have that concierge platform available for you to select CTO if you have any service questions that we are here to help. Thank you so much, Brady.
Thanks, Patricia. So we're at the end of our forum. Think about some questions that you still might want to ask. They don't have to be specific on to this topic. For VA Human Research, you have the IRB representatives, Research Administration and Quality, you have Clinical Trials Office here. So take a moment if there's any questions, if you want to place them in the chat or raise your hand and we can go ahead and take care of those. I want to thank everybody again for attending. And while we wait to see if there's any questions, I want to remind everybody that we do have concierge appointments that are now on demand. The link is here to get directly to the Red Cap survey. But if you go to our website, our VPR website, if you scroll all the way down on the main page, you can get to the concierge request. Also under the quick links that I showed you previously, and it'll take you directly to the Red Cap survey. If you have trouble using that, just go to our contact, send us an email, let us know that you want to meet, and we're available. You can reach the IRB, OCR, CTO, Research and Administration Quality, so we're all available. And I'm going to check back in with Dr. Summers. How are we doing on chats?
Good. No additional questions that have come through other than it looks like Shay is thanking everyone for all the hard work that they're doing and the improvements that are coming. I think a lot of people would echo that, Shay. This is a good group trying to make a lot of improvements. So again,
any announcements?
I was just going to say, if anyone has questions that come up, the teams are all very approachable. I encourage you to reach out anytime you have questions.
Okay, thank you, everybody, and we'll hope to be having another forum in November, December timeframe. Have a good day.
Thank you, Brandy, for putting all this together.
You're welcome. You did a lot of help.
Thanks, everyone. Bye-bye.